Hello everyone, good morning. I am Nilo, a student from Bachelor of Science in Development Communication. For today, we will be discussing a topic which is, I guess, something new for you, and this is art therapy. There will be four parts in the course of our discussion. First, we will be talking about definition of art therapy. Next is the techniques used by the art therapist during their sessions. Next is the benefits and things to consider when you wanted to get art therapist. Next is how to get started. Now, what really is art therapy? Art therapy, this is the artistic method to treat psychological disorders and enhance mental health. It comes from the idea that art creative expression can foster healing and mental well-being. Since ancient times, human beings have been relying on the arts for communication, self-expression, and healing. We've been practicing it for thousands of years. But it is only on the year 1940s that the art therapy became formal program. Doctors and researchers noted that individuals living with mental illnesses often express themselves in drawings, even in doodles and other forms of artworks. This then led them explore the use of art as a healing strategy. Since then, the art is now used in some assessment and treatment techniques. The goal of art therapy is to utilize the creative process to help people express their inner self. Also, this can help people explore emotions, develop self-awareness, cope with, cope with their stress, boost self-esteem, and work on their social skills. Now, here are some of the common techniques incorporated by art therapists to some of their sessions. We have here collage, coloring, doodling and scribbling, drawing, fingerprint, finger painting, photography, sculpting, and last, working with clay. After each sessions and with the help of the outputs of the patients, usually therapists can determine the themes and conflicts that may be affecting the thoughts of the patients, emotions, and behaviors. Sometimes, di ba, what we usually draw are something we can't say by mouth. We unconsciously express the things that bother us just through making doodles, drawing unnecessary lines, and even sketching things we cannot identify. Now, what art therapy can help with? This can be used to help wide range of mental disorders and physiological distress, like aging-related issues. Some people have problems like aging-related issues since they cannot accept the idea of death, the idea of aging that all of us will eventually weather. Next is anxiety, cancer, depression. Depression can be caused by many factors. You may develop depression through your surroundings, by the disease you have, or the illnesses you are suffering. Next, eating disorders, emotional difficulties, family or relationship problems, medical conditions, psychological symptoms associated with other medical issues, post-traumatic stress disorder or PTSD, psychosocial issues, stress, and substance use disorder. Now, What are the benefits we can get in joining or participating in art therapy? According to research last 2016, a study published in the Journal of the American Art Therapy Association, less than an hour of creative activity or less than an hour of art therapy session, this can reduce stress and have a positive effect on the mental health of the patient, regardless of artistic experience or talent. In addition, in studies of adults who experience trauma, art therapy was found to significantly reduce trauma symptoms and decrease levels of depression. One review of the effectiveness of art therapy found that this technique helped patients undergoing medical treatment for cancer improve their quality of life and alleviated a variety of psychological symptoms. One study found that art therapy reduced depression and increased self-esteem in older adults living in nursing homes. When you wanted to participate in this kind of activity or kind of program, you might as well consider these things. First is you don't have to be artistic. A special talent or a skill is not needed in art therapy. When you want to join, you just express yourself the way you want it to be expressed in arts. You don't have to be so talented in drawing or in doing artworks. Next, also people from all ages can participate in this program. May you be a child, a teen, an adult, and even elderly. Now there was a study last 2017 and please let me read it. This This study found out that art displayed in hospital settings helped patients to feel safe. It also played a role in improving their socialization and maintaining an identity outside of the hospital. You see, even just the presence of art in their surroundings, this already plays a great role in boosting their mental health and improving their conditions. Next is art therapy is not the same as the art class. An art class focuses on teaching you new techniques or creating a specific finished product, while art therapy is more about letting clients focus on their inner experience and let them take over their emotions instead of emotions taking over themselves. The third thing you have to consider is art therapy can take a place in a variety of settings. All places conducive for sessions are all possible settings for art therapy services. Usually, these places is described as peaceful, environment related, or where you can see the beauty of nature. But the fourth one is art therapy is not for everyone. As what I said earlier, art therapy can help with a wide range of mental disorders. However, a study found out that art therapy has not been found effective for all types of mental health conditions. It's helpful for a wide range but not all mental conditions. For example, one analysis found that art therapy is not effective in reducing positive or negative symptoms of schizophrenia. How to get started? If you think you or someone would benefit from art therapy, please consider these following steps. First, seek out trained professionals. Do not just get a painter or a random individual. At least get someone who has a degree in psychotherapy or with an additional art therapy credentials. Next is ask about their specialty. You see, not all art therapists specialize in all mental health conditions. Choose those specialized in working with people who have experienced trauma or individuals with substance use disorders. For your part, choose an art therapist that specializes in the mental disorders you are experiencing for a better result. Next is know what to expect and be prepared to answer questions. As the sessions progress or even during the sessions while you are painting, you'll likely be expected to answer questions about your art, how you made it, and how it makes you feel. All you have to do is be open and truthful with your feelings. Just as what I said, be prepared to answer questions so the art therapist will determine and can help you improve your conditions. I guess that would be all. Thank you for listening.